Now, let's talk about potassium sparing diuretics. It is less efficacious and its combination is needed. Only 5% glomerular filtrate appears in the urine and there is no change in the renal blood flow. Now, drugs include steroidal like spironolactone, eplerenone, and non-steroidal like amiloride and triamterene. Now, mechanism of action: spironolactone and eplerenone. It binds to the aldosterone receptor present in the principal cells of the collecting duct and blocks the effects of the principal and collecting cells. Amiloride and triamterene. It does not block the aldosterone receptor directly but interferes with the sodium entry through the epithelial sodium channels apical membrane of the collecting tubule. Now, mechanism of action. It causes decreased sodium reabsorption, decreased potassium excretion coupled to sodium reabsorption, and decreased hydrogen excretion. It thereby causes small increase in the sodium excretion, marked increase in the potassium and hydrogen excretion, resulting in the hyperkalemia and acidosis. This is a picture showing the mechanism of action of spironolactone or other potassium sparing drugs. Now, pharmacokinetics. The spironolactone and eplerenone are the synthetic steroid and competitive antagonist of the aldosterone. There is slow onset of the action and there is greater selectivity for aldosterone receptor in case of eplerenone. Now, amiloride and triamterene. These are the direct inhibitors of the sodium flux in the CCT, and the amiloride has short half-life and more frequent use, and it is extensively metabolized and excreted by kidney with active metabolites. Triamterene is not metabolized. Now, clinical use. It is usually used in combination like edema with secondary hyperaldosteronism in congestive cardiac failure, hepatic cirrhosis, nephrotic syndrome, hypertension, and primarily aldosteronism like Cone syndrome, ectopic ACTH production. Now, adverse effects: hyperkalemia, which is the most serious effect, gynecomastia by spironolactone, hyperchloremic metabolic acidosis, and BPH by spironolactone, acute renal failure by triamterene and indomethacin, and kidney stone by triamterene. Now, contraindication: oral potassium and patient with the chronic renal insufficiency to avoid the risk of the hyperkalemia. Drug interactions: beta blockers hyperkalemia, AC inhibitors leading to hyperkalemia, and ketoconazole and itraconazole leading to markedly increase in the blood level of the eplerenone. End of the topic.